Thank you for coming over here. We know there are alternatives, but everybody wants to know something about machine learning-based healthcare that can be applied right now. Who has actually tried to improve their health or stay healthy using machine learning up to date? I see 1, 2 hands. Not so easy to see these hands. So stay on until the end. For the rest, you can actually apply machine learning today and stay healthy and stay skin healthy. Within SkinVision, we are focused on early detection of skin cancer, early signs of risk, and we do that in a collaborative way. So that's why we have our tagline, Together We Care, and I'm going to go over some slides to tell you who all is involved in order to keep everybody healthy. Our mission as a company is to save 250,000 lives in the next decade, which comes to about 50% of late-stage melanoma cases around the world. And for that, we need a lot of people, and we need everybody to be aware of skin cancer to make sure that we can meet the objectives and to increase the healthiness of those people at risk. So, last slide we saw happy people. Unfortunately, we see a slide where there are not so happy people, and this is purely by coincidence. A lot of people are unnecessarily dying, and that is something that we can stop today using technology, so we should work together to make it happen. So what we do is we actually provide a service that you can all download on your telephone through the Source App Store or Google Play Store, and you can start checking your skin by making photos of your moles anywhere in the world, every time of the day, and at any place, in the comfort of your own home, in the quiet and restful place that you have available at the time it's convenient for you. No more doctor appointments, no more waiting lines, no more taking time off work, etc. So the process is very simple. If you download, you will see the journey. The journey actually consists of awareness creation of what skin cancer is, risk profile, skin type profile, and then start making photos and making assessments to identify skin spots that are in need for medical attention. So you take a photo, you store, and you can compare over time, which is a very important element of risky spots that can change over time into something dangerous. So it's not an exact science and it's not a static environment. A lot of the healthcare processes today are all about very static approaches. You go to the doctor now, doctor has to make a decision now, and 3 months, 6 months, 12 months, or 2 years later, things can progress into something that is unforeseen. So there's a need for continuous monitoring. Skin cancer is growing, and it's growing rapidly, and it actually is emerged as a public health issue and a major challenge. Lots of cancers are skin cancer, 1 in 3 are skin cancers. It's growing rapidly, and there's a lot of challenges in identifying skin cancer at the right place at the right time. So GPs do have a challenge to that. I'll come back to that as well. And dermatologists are scarce around the world. Not in all markets, but in a lot of markets there are. And then there's awareness creation or awareness issues in the recognition of what to look for. So that is all helps for the need for a solution. A solution to the next slide. There it is. So what we have done is we have, in the past years, we're happy to welcome 1.2 million customers downloading SkinVision, taking photos. We are currently at a rate of 2,000 assessments per day. So think about the power of technology in deploying that into the hands of many. And we, in the meantime, found 35,000 lesions that are at risk and needs treatment. All of those numbers actually add up to the creation of our network that actually provides the solution on the technology side. And for that, we have done a few clinical evidence. At the beginning, we were with LMU in Munich. We have a very, let's say, traditional approach where we started off. Then we went to the Netherlands in Catharina Hospital, where we were not only focusing on melanoma, but also non-melanoma skin cancer. And after that, we went to the real-world evidence. So we have a global population study that actually consists of 55,000 people, and we came to even better and better and better outcomes. And this is what is a very good message for all of us, is that we need to learn, and we need to learn fast, and we need to deploy fast in order to be able to accelerate the progress. In just a few years, as you can see here, we have made the stepping stone to become on par with the specialized dermatologist, and for that reason we feel very comfortable that we can deploy our service and to scale up the usage. And for scaling up the usage, we're working with large health insurers, health systems, and we are very proud working with those companies, and there are more that are not on the slide, and there are more talks going on to deploy and to actually make it work today and to assess as many people as possible. So with those partners, we work on a value-based care model where we take the ownership of activating their customers, improving the pathway, and to capture benefits. Just an example, 60,000 people out of a population of a couple of 100,000 start using the service, and those groups actually start to identify spots. There's a high bias of the people that pick up the service that are in need for skin checks. And then we can go from prevention, which is seen as a cost, to more of prediction. And when you start to become predictable, you can also start to make the business models that are helping healthcare systems to really go for scale. And because they basically get only charged for those customers that really need medical attention. For them, there's no reason to not go and do this. So it's a model change, which I think is going to be vital for everything that has to do with prevention, but also for elements or solutions within the deeper health side of things. So what do we predict? On a number of customers, you see a number of lesions that need attention, and that means in our case that we tell customers to go to the doctor, and some of them have to go quicker than others. And then after that, we see that we avoid a lot of cases to go to the doctor by telling that there's low risk, and we help customers to make these identifications in time. And we follow up with customers that have severe cases, like in this example of a predictive model that we have used in practice now in the Netherlands, where you can save lives, and this is just in a matter of a couple of months. So this is not multi-year, this is just immediate feedback and immediate results. And based on that, we can already predict how much savings there's made. And the saving, of course, enables us to grow and to actually give the support to the insurance companies to roll out to other parts of their populations. So this is all what I wanted to say in Together We Care. I hope you have not forgotten the opportunity to use SkinVision yourself today, tonight, tomorrow, during the weekend. And for that, I would like to give you the code. If you still want to come to the booth later, you're more than welcome. And you can use this code to start using SkinVision today and stay healthy. We have a couple more questions, time for questions.
Give Erik a round of applause, please, for that fascinating presentation. I've got a couple of questions, may I?
Sure.
Kick them off. Accuracy was my big thing listening to your presentation. I mean, it is fantastic. It is possibly what we should be doing right now in the state of play. You and I are having a conversation backstage about the future, but also what's happening today. So in terms of accuracy, can you reassure us about the ability to do that diagnosis and be effective?
Yes. So in our studies, and there's a publication this week where we are showing 95% sensitivity on detecting skin cancer. And this means that we are on the level of a specialized dermatologist. And we feel very comfortable giving that in the hands of individuals around the world to make sure that they are on time at the right doctor for treatment.
And how many people have downloaded? The app?
1.2 million.
Okay, and is that geographically specific to an area?
We are available everywhere except the US. So we have a large population in the UK, 200,000 people, Australia, New Zealand, Netherlands, of course, Germany, and we start to see more people coming from Switzerland.
Okay, and so I presume the uptake for it, if you like, has been one of encouragement. People have been willing to take this on board and go
Yes.
with it, as opposed to the traditional format of going to see your doctor, for example.
No, it's purely consumer driven. So these are individuals that are looking for solutions, and that came to us.
It says a lot about the time and place we are in society at the moment
yes.
to have that. Okay, thank you so much for answering those questions. Any other questions from the floor? Please raise your hands. This is truly something that's, well, you may well have heard of it already, but it's, gentlemen just over there at the front, it's definitely at the forefront of what we're talking about. We'll just get a microphone to you if we can. Just coming round.
So, hello, I'm Michael. Do you work with some health system? I mean, if, for example, someone downloads the app and checks for skin cancer, and he has high probability of developing skin cancer, and he goes to a hospital, is it value? I mean, is it accepted from the professional, from the doctor, as
That's a very good point. Yeah.
as a professional diagnosis?
Yeah. So how? Yeah, I suppose. What's the? How do clinicians react to it? So if a patient's coming in with the app and a screen grab, if you like.
Very simple. I always use there. 20% of doctors says, "Why are you doing this? Because you should never trust this." And this is not happening. We strongly recommend you to not look at this. 20% of the people, most of them are the more, let's say, technology advanced doctors that would say, "Okay, great," and look at what needs to be done. And 60% is sort of neutral.
Okay, I mean, I'm just going to get the microphone back to you just to ask you, is it something that you would feel comfortable doing and taking to your doctor?
Yeah, sure, but I mean, if my doctor said that this is not accepted here, I mean, I have to diagnose again to check if this is true. I mean, this would just be a waste of time for both of us.
No, I think our recommendation is really, as a complementary service to the dermatologist, have the dermatologist look at the lesion and take the next step with a dermoscope, with other means, biopsies, because we want to make sure that the customers are into the health system in time and are supported by the right doctor. And sometimes you have systems where customers go to a GP, and of course the assessment level, the sensitivity level of GPs are not that consistent. Let me phrase it carefully. And then we want to make sure that people go to the dermatologist to get the proper treatment.
Okay, something more I have to ask, sorry. So is it, the app is available in plenty of countries around the globe, right? So regarding to the country that someone uses the app and has high probability of developing skin cancer, can it guide you to the nearest hospital or medical professional that you collaborate with?
Yeah, we would like to go there. We would like to go into that model where we support customers to get into the right doctor and to collaborate with those doctors. This is a step for the near future.
You're not quite there yet on that level.
In the NHS, we are getting there. In the dialogue of the whole care path, because there's such a scarcity of dermatology time available. For example, in the Netherlands we are not there, but we are also getting there. It's a bit slower, but it's... And in Germany we are planning to go into that part of the...
Thank you. Just a final question here. Thank you.
Can I ask you about what is your idea about the compliance in 1 or 2 or 3 years? And who is going to, what is the specific group that has a benefit from this? How are you going to manage this? Because is there a risk prediction for people to use? Because you don't want to have everybody in the world use this and create also extra costs and extra diagnostics and extra fear that something is going on.
Okay.
So
Yeah, I
how
think
do you deal with that?
Very good question.
Thank you.
Very, very good question. What we see is actually we are reducing cost. And the more we get the right people to the doctor, because a lot of the visits are unnecessary visits, up to 80% to GPs are unnecessary visits, 45% of GPs to dermatologists are unnecessary referrals. Late-stage melanoma, of course, is a heavy cost on immunotherapy and chemotherapy. So we don't see that risk of increasing the healthcare cost. We do see the willingness of people to take care of their own skin growing. And if that becomes the norm, I think we are in a good shape and we will be able to unlock a lot of potential within the healthcare systems that are really stressed in time. And we are keeping a lot of people safe without increasing the healthcare cost. So from where we are, certainly the high-risk population, so those people that are qualifying for higher risk should actually use it. And then those people that want just to check their skin, we have no concerns because they will get a low-risk rating and then there's nothing to worry about.
Ever the optimist. Thank you for your question. Erik, thank you so much. Erik, everybody, Erik de Heus, thank you.
Thank you very much.